Hospice is an end-of-life pain management and comfort care program for those who are terminally ill. The goal of hospice is to provide palliative care for comfortable living rather than care to cure an illness. If you decide to choose hospice care, a specially trained hospice team can provide physical, emotional, and general support to you and your family. A hospice doctor and nurse are on call around the clock for when you need them. Hospice care is usually provided in the comfort of your home unless you're at an inpatient facility. The hospice provider will send nurses and aides to provide pain management services at your residence. In this video, we'll break down Medicare's coverage of hospice care, including when you can elect the benefit, what services are provided, and how they are covered. To elect hospice services under Medicare, you have to meet a few requirements. First, a hospice doctor and attending physician should certify that you are terminally ill with a life expectancy of 6 months or less. Second, you must agree to receive palliative care instead of curative care for your illness. Finally, you must sign a written statement in which you choose hospice care for your illness rather than any other Medicare-covered treatment. Medicare will then cover hospice services under Part A, regardless of whether you have original Medicare or Medicare Advantage. Services include, but are not limited to, doctor services, nursing and medical services, durable medical equipment for pain management, drugs for pain and symptom management related to the terminal illness, aid services, physical and occupational therapy, dietary counseling, and spiritual and grief counseling. To reiterate, all the services listed just now are covered under the Part A hospice benefit when they relate to a terminal illness. Any conditions unrelated to the terminal illness can still be covered under your original Medicare or Medicare Advantage plan. The hospice provider will make a list of services and drugs that they have determined are unrelated to the terminal condition, and your usual original Medicare or Medicare Advantage cost sharing and coverage rules will apply to these services depending on which form of Medicare you have. Drugs prescribed for the treatment of conditions unrelated to the terminal illness will be covered by your Part D standalone plan or your Medicare Advantage drug coverage. Drugs administered for pain management of the terminal illness will be covered under the hospice benefit rather than Part D. You would owe a $5 copay for any outpatient pain and symptom management drugs. While hospice care is intended for those with 6 months or less to live, the hospice care team can recertify that you are still terminally ill should you live beyond the initial prognosis. You can then continue receiving Medicare-covered hospice care for an unlimited amount of 60-day benefit periods. Each period requires recertification from the attending doctor. Hospice beneficiaries have the right to end their hospice care and to choose curative care instead for their illness at any time. You can do this by speaking to the attending physician about your decision, signing a form that states when care will end, and if applicable, notifying your Part D plan to update your status in the system. You can elect hospice again later if you still meet the eligibility requirements. To summarize, Medicare covers hospice as a comprehensive program of care and support services for terminally ill patients and their families. It's important to remember that the healthcare focus when receiving hospice is on pain and symptom management rather than on curing the condition. We hope this video has clarified Medicare end-of-life pain management and comfort care, and that terminally ill individuals feel empowered to choose the care that fits their needs.